The Thunder Bay District Health Unit confirmed 2 new cases of COVID-19 over the weekend, one involving an employee at a long-term care facility. Now, Dr. Janet DeMille is of course, the medical officer of health for Thunder Bay District Health Unit. She's on the line this morning to bring us up to date on all the most recent developments. Dr. DeMille, good morning.
Good morning, Lisa. How are you?
I'm good, thanks. How was the weekend? What happened?
Oh, it was a bit busy.
I bet.
Busy for my team here, but this is our job, and we do have on-call people. So, and they're very good at what they do. So, I certainly was kept informed and involved, and as we were navigating through this. Yeah.
So, tell me more now about that at the Pioneer Ridge. What happened there?
Yeah. So what happened is, as part of the broader testing strategy that the province is implementing, is they're doing sort of enhanced surveillance testing, and long-term care homes were one of the first groups to kind of move forward with this enhanced surveillance, and basically they were directed to test their staff, and it was going to, I believe it's intended to be every 2 weeks in the month of June, and so last week some of our long-term care homes moved forward with that, and when the results came in, obviously there was one that was positive for one individual at Pioneer Ridge. We believe a lot of the other for that facility came in and they're negative. We're still following up on just to make sure we have the complete list of the testing and the results. But so getting one, and as per our standard processes, of course, we follow up on anybody who has a positive test for COVID-19. And, of course, if it's in a healthcare facility or a long-term care home, we get on that right away, right? We want to kind of quickly be talking to the individual themselves, be talking to the facility, really trying to get very quickly a picture of what's happening, and what's the story behind this positive result. And that happened certainly very quickly on Saturday. We started putting together the picture. We were connecting, of course, with the long-term care facility. They put out a communication to their residents, to their staff, and to the families, and then we did the media release yesterday. Overall, though, I'm, as we gather the facts, and of course we're still working on it and working with Pioneer Ridge to do this, but I was very reassured by a number of things that came forward with that, and this individual doesn't have any symptoms, and that's hard to explain sometimes, but that can be reassuring because generally people who don't have symptoms are less likely to be infectious, for example. And then also just recognizing all the work that long-term cares for homes have done over the last couple of months to really ramp up their processes and what their practices in the facility. So that really reduces any risk of transmission there. And that certainly seemed, we confirmed really that that was in place at Pioneer Ridge. So, and not only that, of course, what this individual does at that facility, and we, of course, would follow up and kind of assess, any interactions with the actual residents, and any interactions with the staff who work with the residents, right? Checking people, does anybody else have any symptoms? Do we have to arrange any further testing, which, of course, we'll do fairly quickly? I mean, all of that is the kind of things that we'll do when we get this kind of report. So very reassured at the present time, but at the same time, of course, it's still a work in progress. We're still getting more information, and we will be following up with the facility and implementing any further measures that need to be in place to be able to effectively manage the situation.
Now, there was another incident in our news story this morning of a man in his 30s testing positive, actually in hospital. What can you tell us?
So, this is another one that's being investigated as we would usually do, and the hospital does very appropriately test people who might be at risk with when somebody presents to the emergency room, when somebody's admitted, or with preoperative people who might be scheduled for procedures, which they're of course resuming tomorrow. So yes, we did get a positive, and again, we are following up on that. I don't have all the details. This was just reported yesterday, so we are following up and kind of pursuing it the same way we would do any other case.
I'm curious, what about Thunder Bay District Jail?
Yeah, so that's certainly something we're going to be following up today, because of course you're probably referring to the fact of the two people without symptoms who were tested, who have a positive test from Kenora, right? Mm-hmm. And there is that kind of surveillance testing happening in correctional facilities as well, and the timing of that, and we will be following up, because I am not sure in terms of what has been done with the correctional facilities around here at the present time. I think I would say, though, we have been working with corrections and with other groups to ensure that people in corrections, or who have been discharged, or who might be at risk of being in corrections, where we do regular testing within that population for people who have symptoms anyway at this present time, and so I'll have to follow up in terms of the surveillance testing. But yes, that's another group that has been directed to do this kind of testing, and we'll see. And I have a little bit of a nervousness about that, but we will see.
Yeah. How fast is the turnaround now for testing?
So you know what? There's a really broad network of labs across the province that over the last couple of months have really done a lot of work with including the public health labs, of course, the Public Health Ontario labs, to really ramp up testing. And we've been monitoring turnaround testing as best we can. We don't have a perfect system to be able to do that. And we were averaging about 2 days for tests done, for example, in the end of May. We were getting the results back in 2 days. However, there were some results that weren't coming back till about 4 or 5 days, but the average was still 2 days. Of course, I'm very pleased that the Thunder Bay, the regional lab of Public Health Ontario, so Public Health Ontario has a central lab in Toronto and has regional labs, and our Thunder Bay, we have one here in Thunder Bay, and they began testing last Wednesday, and they will be ramping up their testing capacity. So now we have actual more testing and the analysis of the tests being able to be done in Thunder Bay here in Northwestern Ontario broadly. So I think that will really help us with getting quick results back on tests that are prioritized. They don't have to be flown down to Toronto. So I'm particularly excited about that for those priority groups where we want an answer really quickly, like in an outbreak situation or a healthcare kind of situation where you really want to paint the picture very quickly so you can put in appropriate measures. So really excited. It was a long time in coming, but very much appreciative of the work that was done both here in Thunder Bay and in Toronto to be able to support that.
Busy weekend.
Yes, it was a busy weekend. So when we hope to maybe have some downtime, that really didn't happen for some people this weekend. But that's we'll do what it takes to do to manage this COVID in our area.
Oh, the public health teams have been remarkable. Thank you so much for joining us this morning.
Yeah, great. Thank you, Lisa. Take care. Thank you.